Welcome to the Oregon Psilocybin Services training entitled, What is the Oregon Psilocybin Services Act? Presenting ORS 475A, or Ballot Measure 109, with the Oregon Psilocybin Services team. We are recording this presentation in November of 2022. My name is Angie Albee, and I use she, her pronouns. I serve as manager for the Oregon Psilocybin Services section. Our section is responsible for implementation of Ballot Measure 109, otherwise known as the Oregon Psilocybin Services Act. Measure 109 was passed in November of 2020 by Oregon voters and is now codified in Oregon Revised Statutes, ORS 475A. We are the first in the nation to adopt a regulatory framework for psilocybin services. Today, the Oregon Psilocybin Services team will be providing you with more information about this exciting work.
And hello, I'm Emily York. I use she, her pronouns, and I'm a program analyst on the team.
I'm Gail Garrett. I use he, him pronouns, and I'm the compliance program manager.
Hello, I'm Jennifer Violet, and I am the licensing program manager.
I'm Jesse Sweet. I use he, him pronouns, and I am the policy analyst for the team.
Hi, my name is Karina Felix. My pronouns are she, her, and ella. I am the fiscal analyst for the Oregon Psilocybin Services section.
Hi, my name is Meredith Ryder. I use she, her pronouns, and I'm the administrative specialist for the Oregon Psilocybin Services section.
The Oregon Psilocybin Services section is housed within the Oregon Health Authority, the state agency that oversees most of Oregon's health-related programs, including behavioral health, public health, and the state's Medicaid program called the Oregon Health Plan. Oregon Psilocybin Services is part of the Public Health Division, which works to protect and promote the health of all Oregonians and the communities where they live, work, play, and learn. It is important to share where this work is taking place because we are making an important and historic shift. Implementing a regulatory framework that centers on client safety and access requires us to shift from a drug policy framework rooted in the war on drugs to a health policy approach that holds promise for healing and wellness. The goals shared by Oregon Health Authority and the Public Health Division become goals that we align our work with as we implement Measure 109. As many of us know, COVID-19 shined a spotlight on the impacts of health inequities across the state of Oregon. The disproportionate experience of disease and death during the pandemic for Black, Indigenous, people of color, tribal community members, and many other populations is a reminder of the work we have before us to meet our agency mission of ensuring all people and communities can achieve optimal physical, mental, and social well-being through partnerships, prevention, and access to quality, affordable health care. Out of this realization, the Oregon Health Authority created a strategic plan with one single overarching goal to eliminate health inequities by 2030. While we know this is an ambitious goal, it creates a framework for us to build from and tie our work to as we implement Measure 109, or ORS 475A. Another important framework to mention is Healthier Together Oregon, Oregon's State Health Improvement Plan for 2020 to 2024. The Oregon Public Health Division provides support and coordination for this work, which is designed as a community-driven strategic planning process for improving health in our state. Grounded in data and community voice, Healthier Together Oregon identifies strategies to advance equity for priority populations, which include Black, Indigenous, people of color, tribal communities, people with low incomes, people who identify as LGBTQIA2S+, people with disabilities, and people living in rural areas. In 2019, subcommittees formed with representation from more than 68 organizations that work in public health, healthcare, social services, education, academia, transportation, housing, and the business community. 5 priority areas were identified, which include institutional bias, adversity, trauma, and toxic stress, behavioral health, economic drivers of health, and access to equitable preventative health care. There is a clear linkage between psilocybin services and addressing these priorities to create healthier communities in Oregon. As we move forward in implementation and shift from drug policy to health policy, aligning with agency and division goals will be an important way to ensure client safety and access with considerations for equity at every level of decision making.
The Oregon Psilocybin Services section is organized into 3 program areas: policy and engagement, the licensing program, and the compliance program. Our team is committed to the creation of safe, effective, and equitable psilocybin services. We are committed to centering equity and working toward the agency's strategic plan goal of eliminating health inequities by 2030. In addition, we are committed to connecting our work to the goals outlined in Healthier Together Oregon. As we continue finding ways to create equitable access to psilocybin services and partnering with communities around the state, we also acknowledge the important history of psilocybin. We do this by recognizing that some Indigenous and tribal communities around the world have used psilocybin for centuries, by recognizing the many decades of research conducted by medical, psychological, and academic institutions that has provided valuable insight into the potential benefits of psilocybin, which has helped create momentum for the work that we do today, by recognizing the complex work of unraveling bias and stigma about psilocybin use created by the war on drugs and other policies, by recognizing Black, Indigenous, people of color, and the tribal communities who have been negatively impacted by the war on drugs, and by promoting justice, equity, diversity, and inclusion in the implementation of our work and within ORS 475A.
What is psilocybin? Psilocybin is a naturally occurring psychedelic compound found in over 200 species of mushrooms that grow around the world. For centuries, some Indigenous and tribal communities have used psilocybin for spiritual, ceremonial, and other purposes. Although psilocybin services will soon be an option in Oregon, psilocybin is still a Schedule I substance under the Federal Controlled Substances Act. Research suggests psilocybin may help address depression, anxiety, trauma, and addiction. Studies have also found psilocybin can increase spiritual well-being. In fact, the Federal Drug Administration, otherwise referred to as the FDA, has designated psilocybin as a breakthrough therapy for the treatment of depression. To learn more about the research on psilocybin benefits and risks, see the 2021 Oregon Psilocybin Advisory Board Rapid Evidence Review on the Oregon Psilocybin Services website at oregon.gov/psilocybin. It is available in English and Spanish.
Ballot Measure 109 was passed by Oregon voters in 2020, and it creates the first licensed program for provision of psilocybin products and services. The measure is now codified in statute as ORS Chapter 475A. We will refer to the ballot measure as ORS 475A throughout our presentation. The statute creates 4 license types. The manufacturer license may cultivate fungi containing psilocybin and produce psilocybin products such as extracts and edible products. Manufacturers are subject to production limits and may only cultivate the species Psilocybe cubensis. Wild harvest of fungi is not permitted. Testing laboratories perform required tests for psilocybin content and species identification on psilocybin products. Service centers are locations where psilocybin products are sold and services are provided by licensed facilitators. Clients 21 years of age or older may access psilocybin services without a prescription or referral from a medical or clinical provider. This is not a retail model. Clients cannot take psilocybin away from a service center. Facilitator licenses are held by individuals who have completed required training programs and qualify for a license to provide psilocybin services. ORS 475A created a 2-year development period from January 1st, 2021 to December 31st, 2022. Oregon Psilocybin Services has used this time to set up systems and processes for the licensing and regulation of psilocybin products and provision of psilocybin services. We will adopt all rules for the section by December 31st, 2022, and we will begin accepting license applications on January 2nd, 2023.
Individuals will be able to access psilocybin services for any reason. Clients must be 21 years of age or older and participate in a preparation session with a licensed facilitator. A preparation session includes a client intake process, informed consent, a review of a client bill of rights, safety and support planning, transportation planning, and additional discussion with a licensed facilitator. After the client has participated in a preparation session, they may participate in an administration session. The administration session is the only time a client may purchase and consume a psilocybin product. Psilocybin products are produced by a licensed manufacturer, tested by a licensed laboratory, and provided by a licensed service center. Clients may also participate in optional integration sessions with a licensed facilitator. Clients may be referred to peer support networks and other community resources.
A facilitator license is for those individuals who will be present with the client during psilocybin services. So, who will be licensed as facilitators in Oregon? Licensed facilitators must be 21 years of age or older, must have a high school diploma or equivalent, must be an Oregon resident. Please note, this requirement expires in 2025, must pass a criminal background check, must complete a psilocybin facilitator training program with a curriculum approved by Oregon Psilocybin Services prior to licensing, and must pass an exam approved and administered by Oregon Psilocybin Services. The statute requires a non-directive approach to psilocybin services. So facilitators will be present with clients to support them without directing the client experience. Many individuals who currently hold professional licenses in Oregon may be interested in being licensed facilitators. An individual must work with their professional boards to understand the risks associated with being licensed under ORS 475A. Licensed facilitators from diverse backgrounds will support the health of communities through culturally responsive and equity-centered psilocybin services. We understand that building a strong network of facilitators with diverse lived and professional experience will create opportunities for aligning services with varying client needs. Individuals who plan to apply for a facilitator license must complete a psilocybin facilitator training program with an approved curriculum as a condition of licensure. Oregon Psilocybin Services does not have a statutory authority to license and regulate training programs, but instead, we are directed by ORS 475A to approve training program curriculum. Another agency, the Oregon Higher Education Coordinating Commission, also known as HEC, may license and regulate certain training programs. To find out if a training program has received HEC licensure, we encourage prospective students to reach out to training programs directly to learn more about licensing requirements and status. Our team worked diligently to develop systems for the online application process and began accepting applications from training programs for curriculum approval on June 6, 2022. It is important for those interested in becoming licensed as facilitators to verify that training programs have their curriculum approved by Oregon Psilocybin Services. To view the list of psilocybin facilitator training programs with approved curriculum, please visit our website at oregon.gov/psilocybin.
How does product get to a service center? Psilocybin products are cultivated and processed by a licensed manufacturer. Psilocybin products are tested by a licensed testing lab that has been accredited by Oregon Environmental Laboratory Accreditation Program. After testing requirements are met, products can be transferred to a licensed service center. Throughout the process, products will be tracked in the state product tracking system by licensed manufacturers, testing labs, and service centers. Product tracking will ensure accountability and help to prevent interstate commerce, which is prohibited by ORS 475A. Who will be required to have worker permits? Employees that perform certain work on behalf of licensed service centers, licensed manufacturers, and licensed testing labs will be required to apply for permits. Permitted workers must be 21 years of age or older and must pass a criminal background check.
Affordability is important to ensure equitable access to services. Under ORS 475A, Oregon Psilocybin Services does not have the authority to regulate the costs of psilocybin products and services. Oregon Psilocybin Services is a fee-based section. This means that the license fees must cover the costs of administering the work. We're committed to equitable licensure fees and will continuously review costs and trends over time to ensure sustainability. We will continue to work with partners, the public, and the Oregon Psilocybin Advisory Board to find ways to increase access to psilocybin services while remaining within the statutory container of ORS 475A. We recognize that successful implementation relies on supporting licensees. Our team is committed to providing an education and technical assistance approach with our regulated community. Under ORS 475A, local governments may adopt ordinances to prohibit psilocybin service centers and manufacturers from operating in their local jurisdiction. Ordinances must be referred to voters at the next statewide general election. They can also adopt reasonable time, place, and manner regulations for their local jurisdictions. In addition, service centers and manufacturers must provide a land use compatibility statement prior to being issued a license. This form, otherwise referred to as a LUX, ensures that licensed premises are compliant with local zoning and land use laws. ORS 475A requires that a city or county that receives a request for a land use compatibility statement, or LUX, must act on that request within 21 days, unless they've prohibited psilocybin licenses in their jurisdiction.
In 2021, our team began reaching out to partners to develop our rulemaking timeline. We heard concerns about ensuring students were trained and ready to apply for facilitator licenses in 2023. We expedited the rules for training program curriculum in addition to product testing requirements. These expedited rules were adopted on May 20th, 2022. ORS 475A created the Oregon Psilocybin Advisory Board, a governor-appointed advisory board tasked with providing recommendations to OHA. The board began meeting in March of 2021 and created 5 subcommittees to facilitate adopting recommendations. All board recommendations were received by June 30th, 2022, as required by ORS 475A. Using these recommendations, our staff drafted proposed rules that were designed to promote equity, mitigate risk to public safety, and create operational flexibility for licensees. These drafts were first considered by rules advisory committees and then later published for public comment. Our rules advisory committee process was extensive. In total, over 50 people with diverse professional and life experience served on the committees, and we convened for a total of nearly 40 hours of meeting time. Our section adopted rules in May, and we will adopt the remaining rules in December of 2022. We will receive license applications and launch the program at the conclusion of the development period on December 31, 2022. And after the rules are adopted, links to these rules can be found on our website, oregon.gov/psilocybin.
In addition to rulemaking, and in partnership with the Oregon Psilocybin Advisory Board and community partners, our team completed several other projects during the development period. As directed by statute, the Oregon Psilocybin Advisory Board published a scientific literature review in July of 2021, and this is available in English and Spanish. In 2022, a cultural and anthropological review was published and also available in English and Spanish. In December of 2021 and again in July of 2022, Oregon Psilocybin Services hosted public listening sessions. Spanish and American Sign Language interpretation was made available along with live captioning. Recordings of these sessions are available on our website, as well as question and answer summary documents to address questions received during the sessions. In January 2022, Oregon Psilocybin Services administered a community interest survey that was translated into Spanish, Russian, Vietnamese, Simple Chinese Mandarin, and Somali. In October 2022, in partnership with the Oregon Secretary of State's Office of Small Business Assistance, we hosted a fall business forum featuring presentations from various state agency partners on topics related to starting a psilocybin business in Oregon. We have a mailing list with over 10,000 subscribers, and we send quarterly newsletters with updates and opportunities to engage. All of these resources and more are available on our website at oregon.gov/psilocybin.
There are several opportunities for engagement. Apply for an open seat on the Oregon Psilocybin Advisory Board. Participate in rules advisory committees. Provide feedback while Oregon Psilocybin Services is in rulemaking during the public comment period or in the public hearings on draft rules. Participate in Oregon Psilocybin Services public listening sessions. Listen to advisory board and subcommittee meetings and make public comments during the public comment period scheduled at the end of each meeting. Sign up on the Oregon Psilocybin Services website for our distribution list. Request a meeting or a culturally specific community circle with Oregon Psilocybin Services, or apply to join the Oregon Psilocybin Services team when openings are available.
The Oregon Psilocybin Services team has been working to introduce the ORS 475A framework to community leaders, government partners, organizations, and members of the public who may not yet be aware that psilocybin services will soon be a new option in Oregon, while also working closely with partners that have experience and knowledge with psilocybin. We are faced with the challenge of building trust with communities that have not been well served by government systems, while also working within the statutory container of ORS 475A that sets the boundaries for what we can and cannot do. Our team is committed to creating a future for psilocybin services that is safety, equity, and access centered. We know this is a great responsibility and are honored to be a part of this work.
Please join us in this journey by visiting the Oregon Psilocybin Services website at oregon.gov/psilocybin. We encourage you to visit our website to sign up for our distribution list and to access important information, such as the scientific literature review, community interest survey, quarterly newsletters, and much more. Stay tuned for more information. Thank you and have a great day.